Does anybody have a shoulder movement impairment? Any pain?
Everybody in the room? We're trying it out. Yeah. Not I. You do. Yeah, I'm staying on the right side of the hole.
I am.
You know, really? Yeah, good.
How are you doing all that talking?
My pain is for rotation.
Okay, good. Thank you for coming.
Thank you for doing this.
Wait a minute, it's not nice to say that. Okay, so, okay, so, okay, look what he does, look at his compensation, just in case. Look how he's compensating for this. So go ahead and do that again.
I've even had surgery for AC joint arthritis and a supraspinatus tear. And I can do all these other movements, but this one.
Okay, you can see how he's compensating over that.
Yeah.
Okay, how about the other arm? Yeah, click over there.
Yeah.
I had my hand on him, right? So that's an adjustment, right? There's has to be hands on. Okay.
Okay, Dr. Cal, you got pain there when you do that? Or are you compensating here?
No, I don't have pain here, but I do here.
But you can see how he's dropping his arm,
here.
He's doing the same on the other. He's doing the same on the other. Similar.
Okay. Do you mind if I take it?
No, that's good. I'm going to show them there.
So, let me just sit down here. By the way, when you're using the camera to take before and after pictures, in order for it to fit into the software and to get the orientation right, what you need to do is just hold the camera and then 90 degrees to the right or clockwise. And then it doesn't matter what resolution the camera is, will fit it nicely. So just go ahead and do that movement and stop as soon as the pain begins. Okay, and do you have pain, or is it just a limited range?
It's pain.
It is pain.
That's all further ankle.
Okay, so on a scale of 0 to 10, what would you say? 5. Okay, so just going to try and get rid of this. Just going to face it away from the body. I mean, facing away from the pad. So I'm just going to start off with 2 belts under the pelvis here.
You said that you had 2 surgeries, supraspinatus tear.
One surgery and both fixed it.
Oh, one time.
A year ago, this next July.
Supraspinatus and AC joint arthritis.
Yeah. I couldn't move my shoulder hardly at all.
Now, arthritis is another thing that's very interesting. I'll just mention it really quickly here. But one of the exercises, I think the research has been very consistent, is that doing extension exercises will actually reduce the chances of the onset of arthritis, and of course helps people with arthritis.
Whose research is that?
I'm sorry?
Is that McKenzie? I'm curious cancer with extension.
I'll send you an email as a reference. I don't have the details in my mind of who's it for, but I will provide you with that.
Spinal arthritis?
Yes.
Do an extension exercise.
Extension exercises. Now, typically it's going to be older people that have arthritis or that have that, and that alone, I mean, just being able to go ahead and say, well, come with you and we'll reduce the chances of an onset of arthritis. That's a valuable thing. Everybody knows it's something that happens. Now, of course, the only way to do extensions, if it's an older person, you really want them lying down on the table doing extensions. That is much more difficult for older people. Having them stand on the system, just facing the pad, strap the belts in, they can always do it themselves, and do their extension exercises on the system. So. Okay, so we've got 2 belts wrapped around the pelvis over there. At no point must I cause any discomfort. If I do, just let me know. A standard thing that I tell the patients is it calms them down, well, not necessarily calms them down, makes them feel a little bit more confident with what I'm doing.
So with the cervical extensions, briefly, you're doing the 2 belts on the low back, and you do couples. They do the straps over here, and then have them twist backwards into your hand or into your pad up there, right?
Yeah.
Okay.
Notice over here when somebody's got a problem with their shoulder, you don't want them to, as I'm taking this belt around, you don't want them to have to do something like this to get their hand into the loop of here, because that may aggravate the pain. So just naturally, I just kind of extended this enough so that you didn't have to lift your hand up.
So you never put that STS harness underneath?
No, I am putting it underneath. It's coming in from underneath the belt.
Like, I mean, underneath the other belt?
That doesn't matter if it's going underneath the other belt. You could do that, that's for sure.
Just find it don't slide off.
Yeah, the main thing is previously we used to do it like this, and now we want to do it like this. Yeah. Okay. Okay, and then I'm just going to put this over here. And tighten this up. Okay, and then that goes over here. This upper horizontal belt has a tendency of sliding, well, not paying attention, you put it close to the throat, and then as you start tightening the vertical ones, and this creeping upwards and hits the neck. So you want to just keep it a little bit on the lower side. Okay, there we go. Okay, the pressure?
Yeah,
Not the time.
that's good.
That's good. When they say that's good, they really mean.
Better make sure they don't have a full bladder too.
Do you have a problem?
No, imagine it's something.
Now he just lost it.
Not anymore.
Okay. What did I do wrong? I built the pad over here way too high, right? I want it to be more like over here. So I'm just going to release this here for a second. I'm sorry. Outside there. I'm going to have to release this here for a second. Roll it down. Is that okay?
Yeah, these are just kind of pulling me down.
What is?
When you went down, these, I don't know like that.
Right,
But I resist.
No.
It's because you're too uppity.
Yes, too high.
Yeah. Sorry about that. It was my mistake. I did that to see if who was going to catch me. Isn't that what instructors do when they make a mistake?
Sometimes.
Just
Well, I
did that on purpose. See, here's a way.
So now I've got this well behind now. Just to pull in the slack and pulling in the slack from the bottom of the STS. Okay, let's get this back and tight again. This needs to go up a little bit now. Just from the bottom, needs to go up a little bit. Okay. Feel the pressure?
Yeah.
Not too tight?
Oh, that's fine.
So in all these pictures here, the pad is too high too.
Yes, right, because this is fairly recent.
Yeah.
You have to give you a good reason to come to the seminar.
Tell me again why you want the pad lower.
I'm sorry?
Tell me again why you want the pad lower.
Because notice how this belt over here, previously the pad was at this height over here, and so the belt came over the top of his shoulder and then straight backwards. But now it's downward, and so when I start tightening this belt here, it's going to put also a downward pressure on his shoulder.
Okay.
Which is ultimately what I want. Are you okay there?
I'm good.
Okay. Now notice what happens when I start pulling the belt. It's rotating his shoulder backwards, and it's putting that downward pressure over there. You feel that downward pressure?
Mulligan talks about posterior lateral 30 degrees.
I know.
But,
I know.
Can't get that.
It's different.
Or it doesn't
We
matter.
go in the other direction. And you know why we go in the other direction?
It works. The other because it works.
It works, exactly. It's okay, the pressure?
Yes.
It's okay? We'll do one more thing?
You could always do that. Couldn't you?
No.
You
I
just
don't
bring it
want
into
to.
such a-
Okay, so go ahead and do that same movement that you did before. Okay. How does that feel compared to before?
Feels like the same range of motion. The pain may be somewhat diminish, maybe a point.
Okay, so just put your hand out. Can I tighten this a little bit more? Or is it till I reach the end?
I'm going to try one more. Have another one. That's pretty firm.
Okay, how about the other side? Can I do one more?
Yeah.
One more, is that it? And it's okay.
You can try one more on this one. Oh, that's quite firm.
Okay, you okay there?
Yeah.
How about the other side, or is that
The other side's quite firm.
Okay,
also.
good. So let's try and do the movement again.
It's about the same.
But so the pain level hasn't gone down.
No.
Okay, that's fine. Okay, so just that's fine. So let's go ahead and do our exercise here. Chris, let's see. Okay.
Yeah.
Okay, pressure. Okay, do that 10 times. So pain doesn't cause any discomfort in your shoulder.
No.
Perfect. Now I'm just going to go ahead and release this bell. Again, I want to make sure that you don't jolt the patient here. Okay. Let's go ahead and do that movement again and see if this makes any difference.
The pain's reduced to another point. I don't feel like I'm moving any further.
Okay, right, that's fine. Okay, that's good. Let's just try and put the belt underneath you here, see if this makes any difference.
Did you want to try holding down the shoulder, please?
I'll do that in a second. Thanks. Pressure.
Yeah.
Try and do that again now and see if this makes a difference.
Pain's about the same. I don't feel like I'm increasing range of motion.
Okay, so no difference.
I'm not.
Yeah.
A little bit, maybe a little bit.
Okay.
Anything less
So
than that, though?
putting that low, then what you say?
Moving the belt here.
Putting the lower pressure.
No, the belt here. Oh, but just.
Oh yeah, you know, I forgot to pull these closer to each other.
See that it makes any difference.
So get the pressure here.
What are you doing now?
I'm just pulling the belts closer to each other.
I'm speaking of the
Forgot
belt.
about that. Okay, try it again now.
Yeah.
Still have it.
Yeah.
Okay, that's fine.
Yeah.
Okay, now how about if I put a downward pressure now? So how does that feel? Go ahead and do it again. Yeah.
It decreases the pain, but I feel like it decreases range of motion.
Right, okay. Do you still have pain when you do that? Or
Yeah.
You still have some pain?
I feel that snap.
Yeah.
That's the AC joint.
Okay, so let's not aggravate it. How would you say the pain is on a scale of 0 to 10 when I'm putting the downward pressure?
I think it drops another point. So overall, I'd say that it dropped.
It was 4 before, and you...
Oh, we're going to O to, you're going to O to 5 or O to 10?
10.
Okay. 2. It dropped a couple of points in pain.
So, okay. So at this point, we could go ahead and just have him do... I'll just go ahead and have him do the resistance, but I'll hold him in the neutral position much further up and just have him press as long as I can get him to do that pain-free. So just go ahead and lift up your arm. And let's just go ahead and hold it a little bit higher up here. No, sorry, not like that. Now I'm going to provide you resistance. I'm going to press you down and just press against my hand. And just press as much that doesn't cause any pain. Okay, and release.
I wonder if you're going on the clavicle itself, Steve, if that would make a difference as opposed to the trap.
This is pain-free, right?
At end range, it hurts.
But I'm not letting you go to end range.
Right when I'm pushing maximally, it hurts.
Then push less than maximum. Okay. Let's stop over here because I don't want to overdo it. What were you saying?
I was just saying if you came down on the clavicle as opposed to the trap.
Okay. I thought that was like doing.
Was he on the clavicle or was he on the trap?
There's other stuff.
He was on the clavicle?
Yeah, he was.
What happens if you just hold your shoulder back a little bit?
Just try.
Cool, just try. Go ahead, do the holding. Try.
It does let me go further.
There you go.
Okay. So,
But you also didn't retest.
Yeah, you didn't read it, that's what I was going to say. What
Did the
fixed it?
resistance?
okay, let's just do a couple of resistance like that. Put the pressure down more and I'll just provide the resistance. Kind of experimenting.
Your line of drive is straight
30 degrees posterior lateral
Pursue a range of motion.
of the collateral humeral head.
We didn't know how much
Press
it
down.
Make sure I'm in the right spot.
Okay, wait just a second.
Go ahead and try
Range of
it.
motion. Wow. Okay, perfect. Okay, so now provide the resistance. Let's just do like 3-4
Not
times.
too hard though. What you guys think?
Let's go with it.
This,
That's it.
you're not going to pain.
No pain.
Okay, let's stop over there. I'm just going to release you now.
That made a big difference.
Yeah. Press the hand and now it's sliding. But that's how we learn. Basically,
That's mulligan. I mean, standing mulligan, you know, the collateral humeral mode.
That's why his name is Mulligan. He has a mulligan. He tries again.
He gets a mulligan.
He keeps trying.
okay.
It doesn't work. Whoops, there's a mulligan.
So take the moment. Take the moment.
You can hear the crepitus in there too.
Yeah. You can feel it. I can hear it.
Just watch your step as you walk off to the side.
Okay, now you can go and ask whether you can take pictures.
Okay, so don't be nice to me. It's okay if it didn't work. It doesn't always work.
Well, that's a lot better.
It's a lot better.
Yeah.
Let me just take a picture from the angle.
Yeah. That's
So
good.
just rotate a little bit further so I'll be 90 degrees.
How's the pain?
At maximum range, I feel a little bit, but not much.
Very good.
It really is.
Less repetition.
Yeah, when you were pushing, it was really,
Yeah, you heard.
the brakes on.
Yeah. Okay, so the instruction would be, okay, now don't overdo it, because previously you had pain over there, so you probably have avoided that movement naturally. And now the muscles, of course, will weaken. But now you're all excited because you got that range of motion, so every half an hour you're going to try it out. And then you're going to get rebounded. So take it easy, and in 2 days' time, when you come back, we'll go and retest it, do more of it. And if you felt good, then you start doing day after day and do that. And obviously we didn't strengthen any muscle, we didn't cure any tissue, because you can't do this so quickly. So it all has to be in the way that the brain is activating. So, okay, well, thank you.
Yeah.